Hello and welcome to the group room where we're at the 34th annual CTRC AACR San Antonio Breast Cancer Symposium. We are now joined by Professor Dr. Martine Piccart, who is the Director of Medicine at the Institut of Jules Bordet. She is Professor of Oncology at the Free University of Brussels and also the incoming President of the European Society of Medical Oncology, known as ESMO. Professor Piccart, the next IMPAKT meeting is being planned, which is the most important breast cancer meeting in Europe. When is that meeting actually, and what is the focus this year? Where are we going with IMPAKT?
The IMPAKT conference takes place in Brussels every year at the beginning of May and is really targeting young doctors, young basic scientists, people from the industry developing new drugs, and we try to get all these people together to really have an opportunity to learn, first of all, what have been the new developments in our understanding of the biology of the disease and what we could do to exploit these new discoveries in order to improve the treatment of patients. So it's a very translational conference with a dialogue that we want to encourage between clinicians and researchers. And we also try to attract pathologists because we think pathologists play a very important role today. And it's not a huge conference, you know, we have 700 to 800 attendees, and that is nice because that gives more opportunities for exchanges.
I'm so glad you brought up the role of pathologists because this is something that I'm so passionate about because of my own life story and where there was a time where you set your pathology and we looked under a microscope, but today we have molecular pathology, and again it comes back to even here patients needing to ask for molecular screening and genotyping of their tissue, and it begins the role of the pathologist now. It's time to get them out of their laboratories and really seeing and talking to patients, because most of us, there are these elusive doctors that we hear about but we never see. And the language and the rapport between the pathologist and the patient has never been as important as it is now. And I don't know if patients are even aware of the importance of molecular pathology beyond the microscope.
You are right. I think that we need to educate patients there because this initial diagnosis based on what the pathologist is doing with the tumor is so important. You know, everything is going...
That's where the new compounds, that's where personalized medicine is rooted. And that's how you're going to find the drugs that coincide with the different pathways and the biology of the cancer cell to create targeted therapies.
Exactly. So we really hope to attract pathologists to this conference, to involve them. And so typically in these conferences, we select one or two key pathways, the ones where we think most progress has been done in the last year. We have some basic scientists coming, explaining the pathway, and then we have drug developers talking about new drugs. And then we challenge one another, and that's what I like about this conference. Somebody told me that IMPAKT looks like San Antonio 30 years ago at the beginning, because, you know, San Antonio is a very translational conference. It's a wonderful conference, but it has become huge. And so IMPAKT is a kind of small San Antonio meeting.
I'm very excited for the time I've spent with you, truly. I have had the pleasure of observing your work and seeing what you do over the last decade, and you're a very inspirational woman and doctor. Professor Dr. Martine Piccart, Professor of Oncology at the Free University of Brussels, the Director of Medicine at the Institut of Jules Bordet, and the incoming President of the European Society of Medical Oncology, ESMO. Thank you very, very much, Professor Piccart.
Thank you.